Renal cell cancer drug development has been exciting over the past decade. We've seen now 7 new agents approved in a relatively short amount of time, which has resulted in the investigator, the clinician, having to try to determine which would be the appropriate sequence of drugs based upon a panoply of data that in some situations may not be fully available to all physicians who may use the drugs. What we try to do is an evidence-based approach. There's certainly a couple of the therapies which have strong level 1 evidence in support of their use as a frontline therapy. This is represented in the certain guidelines. In the United States, we refer to the NCCN guidelines. They've recently been updated by my colleague, Bob Motzer. But there's also European guidelines, i.e. ESMO guidelines, which tend to try to emulate the NCCN guidelines using an evidence-based approach. So if I'm going to use that on the current set of data, there are 2 winners. There is sunitinib or Sutent, which was one of the first agents approved back in 2006, and then a few years later, a newer agent called pazopanib or Votrient. And they both have a strong level 1 evidence from phase 3 trials demonstrating great efficacy, safety, and tolerability, and what we believe, although not proven, what we believe to be a prolongation in survival.